The scar producing moxibustion. So that means every time you have to really moxa with the larger cones, not necessarily larger cones, you have to really cause the skin like turn into red and then blister, and then you leave the blister dry, and then on top of that you mox it again. So sooner or later, this moxa area gonna turn into non-bacterial infections. Yeah, because there's no open wound, right? But doesn't have a blister. And then you keep repeating this kind of moxibustion, and after maybe 2 or 3 sessions, depends on how many cones you're gonna do. It depends also on the patient's body constitution. Some people tend to react strong, like they absorb the heat really well. So in that case, like probably after 2 sessions, and their blister, inside the blister area, not fluid, and it start to turn into palish color and start to have the pus, right? But still like closed, right? So there's no open wound. So you just leave it there and let it, the pus part, it's not inflammation, you call it inflammation, right? Mm-hmm. So that part to heal by itself. So when the pus part all dried up, and then the blister all dried up, and gradually turn into the scar. You do this kind of treatment like quite frequent, a couple times a week, right? Until the pus turn into like a get produced. So that's the purpose of this treatment. And then afterwards, of course, the patient gonna have scar. But I will really suggest you look at a patient's body constitution. Like sometimes you don't want to have a scar-producing moxa, right? The patient said, I don't want to have scar, but I do want to feel better, like asthma, like chronic asthma. But if this person is, you know, some people, their body just like that type. They tend to scar so easily, like any scratch, any cut, anything, they tend to have a scar, right? So you have to be careful. Even you don't really want to, but they may have a scar like formed after your treatment. So you have to really know about the patient's history, like a medical history. They tend to scar easily. Just like you treat people, they tend to bruise easily. So you have to know what kind of medication they were taking, the blood thinner pills, or actual dosage of vitamin C, or whatever they were doing, right? Or they were taking any medication, really try to control their blood pressure or their cholesterol level. So we have to be careful with those, because if you don't know about that, you give them the regular treatment, you probably cause a bruise, right? In this case, you probably have the scar afterwards. So, and then that will be the malpractice. Yeah, if the patient is nice, they're okay with it, you're fine. Otherwise, it's not nice. Yeah. So this is scar-producing moxibustion usually work for asthma. Asthma. And also work for slow develop, like a problem, like say for the weak constitution, right? Really slow to recover. And also work for chronic digestive problems, like stomach and spleen issue, like really have a trouble to digest. Like some people will say, I'm taking so long to digest. Like usually I don't have a really good appetite. I cannot eat too much at once, right? For those kind of condition. And also we're talking about scrofula. I'm not sure I pronounced it right. Scrofula? Scrofula, okay. And also tuberculosis, the early stage of tuberculosis, like not much like deficiency yet. So in that case, yeah, you could use this type of moxibustion. The technique for moxa. So you could use the moxibustion only without any herbs, okay? But you could also add some herbs in the moxa wool, because since you have the wool, right, they're really soft, they're really, really lightweight, right? You could have put a cinnamon powder in there. You could also put a clove powder in there, right? So those herbs will strengthen the heating results, gonna generate more heat. So make the results faster, but make the moxa stronger. And if you wanna make sure the moxa cone you're gonna do, because the moxa cone tend to separate, right? If they don't stay well together, and that's not good. Because when they burn in the middle, they will open up. So you don't want that happen, because you want to heat it concentrated into that little spot, right? If you want to make the moxa cone stay right on the spot area, you could have dipped it into a little bit the garlic juice. You don't have to. You could have just dipped in the water, tiny little bit water, make it moist, and then put it on the point to make sure the moxa cone stay. But if you want to make it stronger, like a cause more blister easily, garlic helps. Garlic juice. I'm not talking about the garlic pieces. You just have the garlic juice in the bowl, and then you dip your moxa cone in there tiny little bit, and then put it on the point. So garlic itself, it causes the blister. So now you put on top the garlic juice, and you put the moxa cone. So you could imagine the blister gonna be so quick to come up, right? And it could be quite a big blister come up. And so this is how you prepare it. But when you start the moxibustion, well, you really have to sit right next to the patient. You cannot say, "I'll be back in 5 minutes." For direct moxibustion, no way. It could be really painful. If you ever done that before on yourself, I mean direct, the burning sensation is quite strong. Like usually people cannot stand it, right? So you really have to, if the patients yell at you, "It's too hot," you have to take it off. So you really have to use your tweezer and then take the whole cone away from the point, right? And tap some cold water on the point, make sure reduce the burning sensation, and then put another cone on top until the blisters start to form, right? You cannot just wait, "Oh, let's burn it all the way to the bottom." Some people cannot stand it, right? It's very, very uncomfortable, that kind of burning sensation. I tried a couple times on my spleen 6. I didn't really intend to have a blister. I thought I'd just do more cones, and then too, I cannot stand the heat, right? And the next morning, I have blisters all over on that point. I didn't want to, right? It doesn't really could have come up right away. So you have to be really careful. If some people really cannot stand that kind of heat, so you probably use the gauze, right? And then dip it in the water, ice water, and then tap it on the area or surrounding area, cool it off, and then you do another cone, right? It really depends on the size of the cone. If you want to treat the asthma, if you want to use the front chest point or the upper back point, so at least you want to use the medium size. And they said the medium size, the chickpea side. If you have the good quality moxa, it's really fast to burn in there. It heat up really fast. So you have to really be on the site. You have to watch your patient's reaction and see how they're gonna react. Some people, like, you even burn halfway. You saw the flame, right? If you have the good ones, and then you don't see lots of smoke, you just see the red flame go just like that, really quick. So when they start to feel hot, you have to move it away and then cool it off. And if your moxa is still burning, not done yet, you could have put it back. But you have to really watch your patient's reaction, okay? Otherwise, it's hard. So usually, for this case, for scarring moxa, you could do 7 to 9 cones. Well, I would say after 3 probably will be pretty hot. people are sensitive, and also depends on the points, right? So that's why we said that usually for the face part, the neck part, we don't use direct. It's very hard, very hard to control the heat level, right? I mean, if you don't want to cause it, then what if later on the patient will really gonna have a scar on their face? You're really gonna have trouble, right? So you just repeated this kind of a whole operation kind of procedure, like doing the mox until you think, okay, 9 cone is done, so we're done for today, right? And then maybe 2 or 3 days later, the patient comes back. But if there is a blister still in there, you cannot go back to put a cone in there. You have to wait till the blister dry, right? No fluid, and then the patient come back, you mox at the same area. Otherwise, you cannot do the same side, right? You have to wait till they dry off, and then do the same point again. So imagine, say, if you want to use 5 points. So today, like you use 3, and leave those 3 for maybe, say, 4 days till it all dried, and next time you come to treat the other 2 points, and then after this 2 dried off, and you go back to do the other. You